Human Services Board meeting. I am Lucy Lawrence, Chair of the Board, and I am calling us to order. We do not have quorum at present, so we will be moving on to agenda items that do not require vote or quorum. And once we reach quorum, we will go back into the agenda. So we need 10 and we have 9. And we are expecting some latecomers. Okay, so we will begin with item number 3. No, I'm sorry, it's 3.5. So this is Graham Fields, who is with us again from Advent Health. As you all recall, at our April meeting, Graham joined us and talked about the certificate of need for the hospital in Weaverville. And you are here to provide an update and to also talk about the additional beds.
Absolutely. So thank you so much. I want to be cognizant of your time. I think my real goal today, is this the best place? You're going to stand over on the other end. That might be better. Let me do that. I think the real goal today is obviously to take any questions about the new application for 26 beds. What is new in this process is really the opportunity for this board and the community to have public input. You know, when we submitted our application, we're very grateful for the letter of support from Buncombe County, from the Board of Public Health, from others. But the real opportunity now is, as private citizens, as your neighbors, as your community, the flyer you have in front of you, the month of July marks the public comment period, where you can share any and everything you want to about who should get these beds and why. And I'm, obviously very biased, but you're welcome to share whatever you'd like. And so we've tried to make it easy for you. One of the things that we're going to do is, if it's appropriate, I'll send out just a link to the opportunity of how to write a letter, who to write it to. There's even an email click for that. So in July, we're just trying to encourage people to participate. Whoever they support, whatever they support, please do it. It's a little like voting. The other piece that's coming up that I would certainly encourage you to participate in is on August 19th, there is now scheduled a public hearing. So it is an opportunity for you in your capacity here as a board, as an individual, in your community, to participate on behalf of really yourself at times, to talk about what you feel like would be the best future for these beds in Buncombe County. And so I think for me, I would be happy to take any questions about that process and also try to explain a little more about the 26 beds. We had mentioned that. What would that mean to add to the 67 that we're approved for? I think the two things that would be big takeaways for you are, number one, it would be interventional cardiology. That is something that would really be explored at that point, and we'd have scale. The other would be a NICU, and I think about from the health department. MAHEC does a great job with high-risk pregnancies, but I think for us, that volume of OB, particularly from Buncombe, Yancey, Madison, others, would give that family or that woman a choice. And so for me, that's exciting. Also is the potential of interventional radiology. So I think the acuity would go up at that hospital at Weaverville. The scale and scope would go up. One other thing right quick, and I don't want to, again, you were kind enough to let me do a presentation. I don't want to in any way take too much. We also have our architects and engineers and design folks in town. And they are actually meeting in Weaverville next week on Tuesday afternoon. So we have invited the county and certainly anybody from the health department that would be a good representative, simply to shape that process. We've got an engineering and architecture group that has an Asheville office. They're also in Raleigh and other places. And they're really sort of asking that question of, what do you want us to consider for your community so you can have a role in the whole process? So that really is my simple presentation, is please participate. Write a letter of support for whoever you support. It's a public hearing. It matters. If you've been to one of those, the more folks that show up, I think the more robust perspective the state can have on the future of healthcare in West North Carolina. Any questions? Yes, sir.
Yeah, I have a question, but it's more of my not understanding how the certificate of need
Sure.
committee
I'll
and
try.
process work.
Sure.
So you've explained the last time that the certificate of need committee, which I guess is state run, has determined that this area will support 26 more beds.
Additional beds, yes, sir.
But does the committee stratify it like you're stratifying it in terms of whether it's a ICU bed or whether it's a cardiology bed, like they do for MRIs, CAT scans, and other medical needs that the certificate, the CON committee deals with?
It's a great question, and they don't. So there's not that level, that granular level. So they will say there's a capacity, and they look at it on inpatient, both discharges and inpatient volumes. And so then they project in a health plan for that year, the committee does, what the needs will be. They approve it, send it to the governor. But it's open to the applicants to shape those beds. So the idea would be it's 26 beds. It's conceivable. One could have made those 26 beds great specialty beds, right? That we're trying to make them as broad as we can. We're applying for acute care beds. We're applying for beds that could be anything from cancer to med-surg to ICU. One could, and Novant did, to say these are all cancer beds, right?
The only thing I can gripe about is it just sounds like a weakness of the CON process with the state.
I understand. So it almost becomes, tell us how you would utilize them. What's the best use? And I think my message, and it's a selfish one, would be, I think, given our current healthcare landscape, it seems the broadest use of those beds that the most people could use them seems to be one of the criteria that they'll judge. So to answer your question a little more thoroughly, I thought carefully, when they evaluate them for a CON, there are criteria. And so those criteria are everything ranging from who serves the most people, who serves the most DRG codes, the most actual, can do the most with those beds, who creates competition, who considers rural populations, people of color, women, those with special needs. Like there's all kinds of criteria that each application will be graded on. And one of those is the scope. And so one could narrowly tailor them, but they probably put themselves at a bit of a disadvantage when they're evaluating someone else saying it's an emergency department bed or it's an ICU bed could say, I cover the whole gamut. And we are trying to cover as much as we can with those beds.
Thank you.
Any other questions or comments or input?
Where is this event on Tuesday?
It's actually at the Lake Louise Weaverville Community Center at 2:30. And so that is the goal, is to really have it. I certainly will have invited county commissioners from Buncombe County. Taylor Jones with EMS will be going. Jamie will be going. I just wanted to make sure the health department had potentially and social services had some representation just to shape that, because I think it's not a one-time thing. I really would like it to be a cadence of some sort over every few months when we get the design team together to say how we orient the hospital, how it looks, how it doesn't, again, access points, all those things for EMS and public health. We want to be transparent in that process.
Do you anticipate any other medical facilities being built in that general vicinity?
To give you an idea, that 30-acre site that she's talking about is if you know where CVS is on 2570 in Weaverville, 30 acres are behind it. We purchased the concrete plant and acres, yeah. So the goal would be to also have a medical office building. So one of the things that I would very much like your input along the way, please, would be what are those particularly specialty physicians, the specialty physicians that you are most interested in having access to? And that's one of the things, Dr. Frank, that you and I have identified. Where are the physicians that people are having trouble getting into or long wait? So imagine a building that would be filled with hopefully specialty physicians, probably orthopedics as well, but especially cardiology, ENT, urology, everything you can think of. That would be our goal. I will tell you that there is a plan from the standpoint of a bigger footprint to say that hospital, of course, is an epicenter, an important piece, but not to neglect Madison, Yancey, nor East Asheville, Swananoa, Black Mountain, West Asheville, Lincoln, Candler, to think about what infrastructure would be helpful to keep people out of the hospital there. And I think that's kind of the narrative we're trying to change, is that, that hospital is something I hope you don't see, honestly. I mean, it's great that it's there. I want it to be there, but I hope you don't see it. So, well, I appreciate it. You all have my contact, hopefully. I will send you, if it's acceptable, I'll send you a link to this or send it out through this, that you can just click and support anybody that you choose, honestly. And if you have any questions, feel free to reach out to me. And again, I hope that maybe the health department, that's the county, to tell them how we should build the building. Thank you. Appreciate it.
Thank you.
One more thing, and I'll hush. Do you have any more of these?
Sure.
I live in that area, and so I have friends and neighbors that I can
Of course.
distribute this to.
Of course.
Thank you.
Absolutely. Thank you very much.
I'm happy to report that we now have quorum. And so we will begin at the top of our agenda with our first action, number 2, review and action of board agenda. I do want to let you know that I would like to propose an amendment in number 5, adding old business, an update from Colleen on winches funding. Do we need to have a second for that?
Yes.
Okay. Thank you, Dan. All those in favor of accepting the agenda with that amendment? Aye. Any opposed or abstentions? Great. We will move on with the agenda. In accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflict. We are moving now to agenda item number 3.
Lucy,
Yes.
as far as the update on winches funding, I'm happy to participate in whatever level is appropriate as far as conflict of interest. But if I need to recuse from any part, I certainly can as a winches employee.
Thank you. Thank you. So number 3, review and action of our June board minutes that are included in your packet. And I will entertain a motion and a second to approve. Thank you, Leanne. Is there a second? Thank you, Linda. All those in favor? Any opposed? All right, thank you. We move now to agenda item number 4, and we will have our annual board meeting with Dr. Colleen Bridger.
All right. Hi, everybody. For those of you who have not yet met me, I'm Colleen Bridger. I'm the interim director of the department while the county searches for a permanent replacement for Stoney, who's here and who we will recognize a little bit later. One of the requirements of boards for the health department to receive accreditation is that we go through an annual board training on what your roles and responsibilities are when it comes to public health things. So I'm going to cover that pretty quickly. I understand last year was a bit painful. Hopefully this will not be painful, and happy to have you interrupt me with questions. Please do. Or if you want to wait till the end and ask questions, that's totally okay too. I will say my background is I was a local health director in North Carolina for 25 years. And so I have given this training a lot. So it was easy to slip back into those shoes. I did, though, start this with a little high-level context as a consolidated board. So, and here's all the general statutes if anybody else but Kurt wants to know where I got this information. So why are we here right now? It's because on September 4th in 2012, Buncombe County commissioners voted to consolidate health and DSS boards into a consolidated human services agency. That's been a while. You were really on the leading edge of that process and have been looked to across the state as a model for how this is done. I took this picture from your bylaws essentially, but did want to just kind of remind you how this works. So you can see you're the Health and Human Services Board in green. You recognize your executive committee, and then you've got some program area committees, and then as issues arise, you can form ad hoc committees. You are the advisors to the director of the department. So you represent what the community wants. You represent subject matter expertise. You represent the devil's advocate in some cases when the department's going down a certain path because that's the path they've always gone down. You have the opportunity to provide another perspective. And so all of that is a really wonderful broadening of perspective for the director of the department. The director then shares that information up through the county manager's office. In a consolidated agency, the director reports to the county manager. When it's just a Board of Health or just a DSS, the director reports to those boards. But now that you've consolidated, the director reports to the county manager's office, in this case through Sybil. And so any recommendations, decisions made by this board gets transmitted from the director to the county manager. And then she, of course, reports to the Board of Commissioners. She will share that information to them as is appropriate. So this is a really important but ugly slide. And this came directly from the School of Government, where it lists exactly what the roles and duties of a consolidated human services board are. So I just want to make sure that we're all really clear on what this is. This is kind of like one of the most important slides. So setting fees for services. So like how much the health department charges for a certain exam, a certain test, that all has to come through y'all. Assuring compliance with laws related to state and federal programs. And that's typically while holding the hand of all of the various oversight agencies. So either it's the state level agency or it's the federal level agency. You're never expected to do that all by yourself. It's usually some other government entity who says thou shalt, and you say, are we? And the director says yes. Recommending the creation of local human services programs. So I think the most recent example of this was the pilot that you're doing on the harm reduction side to help people have access to smoking supplies rather than injection supplies as a way to reduce the harm of drug use. That's a perfect example of what we're talking about. Adopt local health rules and participate in appeals related to enforcement of those rules. We're going to dig into that a little bit deeper later, so we're just going to put a pin in that one. Perform regulatory health functions required by state law. Also, we're going to talk about that a little bit more. Act as a coordinator or agent of the state when required by state or federal law. That's fairly rare and is always, of course, done hand in hand with the director and another government agency. Plan and recommend a consolidated human services budget. So I have learned that the budget process starts after Labor Day, which is going to be here before we know it. So I will be involved in the beginning stages of that. And of course, y'all will be involved as well in helping to kind of craft and put together a budget that represents the priorities of this board and this department. again, as a reminder, that will go as a recommended budget to the county manager's office. She crafts her county-wide manager's recommended budget. She shares that with the Board of Commissioners, who are the ultimate decision makers when it comes to the budget. Conduct audits and reviews of human services programs. That's rare. But sometimes you'll have to say at a board meeting, yes, we received the results of this particular audit, this particular review. Advise local officials through the county manager. So again, this kind of hierarchy in the way that you were designed. I will say that there is an option in general statute that allows Board of County Commissioners to serve as the board over Health and Human Services. In Buncombe County, they decided to create an consolidated advisory board. And in doing so have said, we want you to funnel information through the county manager's office to us rather than us being involved in the day-to-day operation of the department. Perform public relations and advocacy functions. Hopefully y'all are doing that all the time. Yes, sir.
So just a question, because that's the first time I kind of saw that we are supposed to advise local officials through the county manager.
Mm-hmm.
I always understood that structure, but whenever we write letters of recommendation, we direct them to the commissioners themselves. And so are we like technically supposed to like talk to the county manager?
Yes.
Have we ever done that?
I don't know.
I don't
In my 4 weeks, I've been there, y'all done nothing wrong.
I mean, Dan, to answer your question, historically, I don't think that has been done. I
Yeah,
think a lot of
We go
it.
straight to the commissioners. That's what I
Well,
was.
I think a lot of it is how the HHS director is wanting to present things to that. And so sometimes there have been a few times, like writing the letter for the Dobbs decision or
That did.
I think with some of the other things, it's merely a step.
Yeah. I'm just wondering if the county manager ever got mad at us.
I will say with the letter regarding the Dobbs decision, I did have a phone conversation with Avril.
Okay.
She had called me.
And that was what I was going to recommend is,
Yeah.
Probably what this bullet says to me is have a conversation with the county manager. And if she thinks it's best for you to go directly to the board, then go to the board. If she would like to be the funnel for that information, then it'd be probably best to funnel information through her.
Well, it's an interesting point because I'm not sure if she ever attends this meeting. Like maybe there's an opportunity for,
I'm
Well,
attending
she's-
in her
in her
stead.
The assistant county
yes,
manager
and-
is
yeah.
in her stead.
okay.
Yes. And that's preferred methodology for us. And I hope to be at more of the meetings and hear conversation and share whatever y'all want me to share
Yeah.
Directly to Avril. So.
And do you normally
Absolutely.
come?
I've
Or is this
been
a
to
new
the
thing?
last one. I'm new to this role, being
Okay.
over HHS. So I started July 1st,
Okay,
being over HHS.
Okay.
Yeah,
okay.
So I have 3 days more experience
Yeah.
than Sybil does.
Yeah, except for you have 25
just so-
years as a health director.
I mean,
so
when we
that's-
were meeting in person all the time, I remember there was a lot of people in the room.
Yeah.
And I think that the county manager was coming on those, I remember that
We
back
did
in the
have-
day, like
yep,
3
yep.
years ago or
We were-
before pandemic
Yep,
times.
yep.
And then that stopped.
Yeah.
And so it's a healthy reminder to kind of keep that communication.
Yeah.
So that's good.
And I can't promise I'll be at every single meeting, but I'll try to come. But if there are items that you guys want to share with the county manager, I'm happy to be the conduit.
And there is a former, as former chair of the board, and I think Lucy has once a year gone before the county commissioners to kind of speak in an annual review. It's not necessarily promoting a policy or a letter or anything like that, but there is that degree of direct communication with the county commissioners on a yearly basis. Have you?
I have not, but
Yeah, not.
no, but I need to talk to you about it.
Well, yeah, you need to.
Yeah, so we like to have all of our boards present at least once a year on what's
Well, I need to get on the agenda.
Okay, well, I'll make it up, then we'll pass that message on.
So in the past, there was actually a county commissioner who was assigned to this board?
That's right, we used to,
We do.
We-
Yes.
we used to have one.
Who is
No,
that?
that's still,
Still do.
Jasmine, I
Jasmine
believe.
Beachboro.
Yeah.
She hasn't come in a while.
I was gonna say, I
Yeah.
don't wanna
I
be
don't think she's come in a long
I
time.
think that she might be on medical leave.
Yeah, that's what the papers, the media says.
Boy, this
yeah,
is
she's
going
been,
down a lot of rabbit
she's
holes.
been unable to attend.
Well, don't we have in our bylaws that if you don't attend more than 60% of meetings, you're kicked off the board?
I think
think
there's an
it's
exception for
75.
medical reasons.
Right.
But Dan, you do bring up a good point because Jasmine's term on the commission will end in November when we elect another commissioner.
Yeah,
will
she,
just-
she will rotate off on December, the first Monday of December is when the new commissioners will take place, and then they will determine
Yes.
what board or they will sit on. So you will have a new board member probably for your January meeting, assuming that we don't meet in December.
We will meet in December, but we will meet on the third Friday
Okay.
instead of the fourth Friday. So
Okay.
So
if,
maybe you would have a commissioner by
if
then.
that person
you would,
is in
yeah.
place by then,
Yes,
Would you still attend?
yes,
Okay.
yes. I'll try to be here as
Okay.
much as I can.
All right, good. Protect the public health to the extent required by law. We're gonna dive into that one. And then develop certain dispute resolution procedures for basically people affected by public health rules that you pass. So let's look specifically then at public health stuff. So there are three broad categories of public health responsibilities that fall to this board. Adopting local public health rules, imposing fees. So how much somebody has to pay when you go out to inspect their septic system, for example, is a fee that you would set at this board. And then adjudicating disputes about local health rules. So if you were to pass a public health rule about wells, which is a frequent rule that boards of health pass, and somebody would like you to make an exception, or they feel like they're adversely affected by that rule, or they haven't paid their bill, that would all be things that could potentially come to you to remediate and adjudicate that problem. That is very rare. Okay, so this is where we're going to pivot a little bit and you're going to put on your imaginary Board of Health hats. Because this is the crux of the training that has to be provided to you in order for the health department to receive public health accreditation. I will say that there are two types of accreditation. There is North Carolina accreditation, which is mandated for all health departments. North Carolina was the first state in the nation to require accreditation of their health departments. National accreditation is the other type of public health accreditation, and it is eerily similar to North Carolina accreditation standards, probably because 50% of their staff came from North Carolina. Sometimes boards wonder if they should be dual accredited, national and North Carolina. My recommendation is no, because there's so much overlap. I don't think it makes a lot of sense, and it's very expensive. So at its crux, your responsibility is to protect and promote the public's health. This is the second time we're going to talk about your roles and responsibilities as a Board of Health, because we have to. But you can see, adopt public health rules, adjudicate disputes, make policies, set fees, and then there at the end, satisfy state accreditation requirements. That one, okay. So we're gonna talk a little bit about Board of Health rules, what they are, what they aren't, how you go about the process of setting a Board of Health rule. And I'm going to tell you that you should approach this presentation like you would if you were studying for an open book test. You will never have to do this without the help of experts. You will never have to do this from your memory. This is just to have you have some exposure to understanding if something doesn't seem right. So that's the purpose here. And please don't feel like you're going to have a test at the end and are going to have to remember all of this. So essentially, a Board of Health rule may either prohibit people from taking certain actions. So for example, when I was the health director in Orange County, which is where Chapel Hill is, we passed a no smoking ordinance that prohibited people from smoking on sidewalks. And so that would be an example of a Board of Health rule that prohibited people from doing something to protect the public's health. Or you can require people to take certain actions. So that's a lot harder to do at the local level. But a good example of that would be a lot of counties have a little bit more stringent well ordinances than what the state requires. And so some places, depending on what their water tables look like, may require grouting of the well a deeper distance than what the state requires. So that would be an example of being told you have to do something to protect the public's health. It is an administrative action and you can only take it where authorized by state law. So there are some limits. You cannot pass public health rules that are specific to food and lodging. So you can't say restaurants have to prepare their food a certain way. The only legislation, law, rule that affects restaurants are federal and state, and mostly it's federal. So with I've referenced wells. So the first thing that I'm assuming that you have done is you do have to adopt by reference the state's well rules. And then you can make it more stringent if you feel like that would be a way to protect the public's health. Again, the most common addition that I have seen across North Carolina is the grouting issue. So making sure that the grouting will go down farther. As far as the on-site wastewater, so your septic systems, for example, you have to approve. You cannot make your rules less stringent than what the state has. And if you want to add anything, and some counties do, and it's really technical engineering type things that they decide they want to do, the state must approve it. So this is one area where the state has to say, yes, this makes sense, and you can do it. And then, of course, smoking. There's been all sorts of movement in North Carolina around what boards of health can do to regulate smoking, and tobacco use now has expanded a little bit more. Specific to tobacco, if you want to pass a local Board of Health rule, before it can go into effect, the Board of County Commissioners must also pass it. A lot of these other rules, the Board of County Commissioners does not have to pass it. They have no involvement in it. You have the authority. But with smoking, the General Assembly added this additional requirement. So this is not going to be on the test, but this is a very fun little learning experience for those of us who were working with boards of health like 20 years ago. So there was a situation where a county wanted to create a Board of Health rule that would prohibit smoking in restaurants. So this goes way back. And they wanted to be sensitive to the economic impact of this rule. And so they said, if your restaurant is this small, you're exempt. And that rule got overturned because the court said boards of health cannot consider economic impact in their decision-making. They can only consider public health and does this protect the public's health? And so, you know, that's a good thing to keep in mind as you're thinking about crafting Board of Health rules, is the only thing you can consider is this going to protect the public's health? And it'd be nice if you could think in more shades of gray than that, but the courts very clearly ruled that you cannot. So here is your handy dandy rulemaking checklist. So you'll have a conversation at the board level. You'll talk about, oh, we should have a rule that prevents people from smoking on sidewalks. And then you have to kind of work with Kurt and his office and figure out, what are the legal ramifications of a rule that would do that. I will say in Orange County, for example, we determined that we could do that because we maintained the sidewalks. Even though they were not county owned, they were county maintained. So it's that nice little nuance that the county attorney's office can weigh in on and help you kind of navigate how to craft this. Then you'll draft the rule, and then you'll go through hopefully a series of public input and public information sessions. And your health director will kind of help you adhere to what the legal requirements are, and hopefully you'll do more than just the bare minimum. Then you have to have the right notice to all the right places before you have the vote. You'd have the vote to either adopt or not in an open meeting. You can't go into closed session and vote on this. And then you would implement and make sure that you can enforce this rule. So again, please interrupt me if you have questions. I'm not seeing any hands. So this is the third time that you get to see this. So we can definitely prove for the Accreditation Review Board that you have seen this. But again, the primary purpose here is to support the department in achieving its public health goals. And this is one way that you can do that. Here are some references for your late night reading, and I'm happy to answer any questions.
That's it?
That's it.
Oh, wow.
Much less painful than the
The
modules.
modules, oh my God.
Oh my gosh, and we did have
I thought we
tests
had another
with
like
those
hour.
That's right.
Yeah, so thank you very much,
Well
Colleen.
done.
You're welcome.
You should take this on the road. Wonderful, thank
You
you.
make a modular.
Yeah. Seems like that's the curse of death though, right?
Do we have to sign in anywhere that we were here for this?
Krista's
Oh, Krista.
capturing.
Oh, okay.
She's
All right.
capturing that you're here. That'll be in the minutes. We will
Can I
attach.
say all the board members that aren't here have to do all those modules again?
Actually, we are sending them a recording of this presentation and the slides.
Okay.
And they will be able to go through it in an equally less painful way.
Thank you. We are moving now to old business, and did Rebecca step out?
Oh, shoot. Okay, well, we can flip order. Would that be okay?
Sure, you go ahead, Colleen.
I do want to say on the Rebecca letter, you did get a copy of the letter, and Rebecca is here if you have questions. It is not her intention to go over the letter with you. We assume that you read it, but she will be here to answer any questions that you have about especially who do I talk to about showing the documentary? So, but okay, so a question came up last night. I don't know if Dr. Frank, would you like to set the stage, or do you want me to just?
Sure. I kind of heard this from a community partner. that that the usual funding mechanism, so for the last 14 years, the county funds the public health partner through winches. So way in the past, when the health department used to do clinical care, that changed, and there was a partnership with winches to provide access to health, dental, behavioral health services, clinical services, and that contract has been there ever since. But this year, it was the contract was reduced by $1 million fairly quickly, and so this is what. And my question was, so where's that money going? And the response was, we think that it just went away. And so that's $1 million out of healthcare access that got changed out of our budget that we didn't have a discussion about. And so I kind of asked the question, hey, what happened? One of our roles is to plan and recommend a budget to the commissioners. And we had a lot of discussion about certain other aspects of the budget, but this one never came up, and that was a little concerning to me. $1 million out of healthcare access, which will reduce the ability to expand dental access and clinical access and other access, which we know that there's a significant problem in our community around access. And so taking $1 million out of access just like that without a discussion seemed a little bit odd to me. So I wanted to bring it up.
So what I know is that this was a late in the budget process decision that was made as the county manager's office and the Board of Commissioners were trying to figure out how to find an additional, I believe it was like $5 million. This was one of the kind of last minute cuts that had to be made. And so the funding for winches, I think, is still at like 1.6.
Yeah.
I think it's 1.6 million. But they did take a $1 million cut, and Ellis has a meeting with Kim scheduled for, she thinks it's next week, so that Ellis can bring back to you a more concrete understanding of what the ramifications were of that cut. Because right now, all we know is there was a cut, and she and Kim are going to talk about what did that cut mean? Where were services reduced as a result of that funding cut? We did put this under old business because the budget has been passed. But it is certainly something that as we're working to craft next year's budget, we can talk about and try to better understand for moving forward. I will say that there are now 4 FQHCs in the county. And so what I have asked Ellis to do is reach out to all 4 of the FQHCs to figure out if we had an RFP process to allocate those funds, what would be the best process for them as the potential bidders, because we don't want it to be overly complicated or burdensome. But, kind of thinking about how things have changed over the last 14 years, we do want to recognize that there are now more FQHCs.
Yeah, so I fully agree that it's reasonable to open up an RFP process for county funding for access, but that's not what happened. $1 million just got cut. And we have an access, and it was after our approval and recommendation. So that's my biggest concern. I think opening up an RFP process is probably a good idea. But we are in the midst of still significant healthcare access despite our 4 FQHCs. And I speak to it from running the free clinic because I see all those patients. I see the patients who have Medicaid who cannot get in. I see all of the dental. We get 10 phone calls a day looking for dental. And Winches is the only one that is really opening up access for dental. And this just totally slashes their ability to do this. So it's just the timing was really bad and really not thought through the impact. So I like the idea that we're going to get some more information about the impact.
Mm-hmm.
And I like the idea of RFPs too, but just taking $1 million out of the system like that overnight is gonna hurt us.
In a population that needs advocacy and help and cannot fend for themselves. I mean, that's an 80% cut in their budget in a population that is the most needy.
Yeah.
I mean, that I don't think is something that this board would ever approve of.
Yeah.
So as it goes through the county commissioner to the commissioners, you know, it seems like it should go the other way around too. If someone's
Yeah,
gonna
they should
cut
close
something
the
by
loop.
80% in
So-
this population, they should have run that by us as well.
So this is one of those I would like to see, could we ask the county manager to come when Ellis explains what the impact is? But I'd like to understand what the county manager was thinking about
Well,
pulling $1
remember,
million
it's the
out
Board of
this.
Commissioners who passed the budget. So I don't want to pile on the county manager.
I feel the angst. But is there any way to obtain data, maybe annual data in terms of, you know, number of providers, services rendered, and number of people seen
Mhm.
annually? Because I know you referenced that there are more free clinics in the area, but at the same time, it'd be nice to see what Winch is subsidizing, what they're seeing, how it's growing, and maybe can identify impacts of other free clinics too. But if it's growing, as everybody appears to be saying that it's growing, I think a reasonable commissioner might be able to financially understand the need better if the hard data is present.
So process-wise, would you like Alice to present her understanding of the impacts at the Public Health Committee? And then that gets shared up through the board that way? Or do you want it to come directly to the full board?
I think it should come, well, this is just me. I think it would be helpful if it came to the entire board because it's now beyond committee consideration.
Okay.
And it affects everybody.
Yeah.
And just before, I know Casey can't, has to recuse herself from conflict of interest in her role at Winch's, but I think it would be helpful to you just to give a little insight of it, because this just happened like a few weeks ago, right? And you guys are now in the midst of figuring out what you're doing. And so just give us a flash in the pan of what's happening, because
Yes, that's right. We are going to have to make some decisions about how to absorb that into our budget. We don't know yet how we're going to do that. We're looking at a lot of different options. The one option that we do know we're not going to be able to do is we're not going to be able to expand our dental program. So we had been in the process of hiring and moving forward with some additional appointments and locations, and we're not going to be able to do that.
So if Ellis can put together this information by the next board meeting, is that something that you would like to see? So we can have, you know, what are the budget impacts of this $1 million cut? And then to your point, what has the trend data looked like as far as services provided? Has that been increasing over time?
Yeah, you probably want to see annual budget
Mhm.
and annual services
Mhm.
and include, you know, the providers and the structure and how you do it. Just because if there's a trend of growth and there's a need, I think that needs to be more than obvious than.
Well, I misspoke. It's not an 80% cut, it's a 61% cut. But how can you grow if your budget's getting cut 6.1, 60%?
Yeah.
Well, and it's also a 61% cut in their county allocation, not in their total budget. So that's a important nuance.
But again, I want us to make sure that I would say, I don't want us to focus on the Winch's side of this equation. I want to focus on the county's investment in access to healthcare that just got cut by $1 million. And that was never part of our frame of what we think that is in the interest of the health of our community, is to cut access to healthcare funding. At this time, I mean, it just doesn't make any sense.
Who is the board's county commissioner liaison?
Jasmine Beach Farrar.
Okay. It's obvious that she hadn't been to any meetings. Is there someone that we could get to replace her? to come to these meetings, so they can.
That will all happen in December after the election.
And I'll just want to say, as the representative from the county manager's office, this was a difficult budget year. We did not have the revenues that we, hoped to have. And there's no department that did not get cut. So just wanting to know, it wasn't anything particular about HHS or anything about that service. It was hard to balance the budget this year. So not everybody got everything that they wanted by any stretch of the imagination. So.
But at least if you get the figures, you can understand how the decisions were made or not made.
Yeah,
You know,
and I mean.
because you want to have strength in data.
Right. Oh, yeah, absolutely. And I think it's wise to understand what the impact is. But, and you all know this, the commissioners are balancing so many priorities. Schools, I mean, that's 30% of our expenditures is education. So that's a huge part of our budget. So they're, paying teachers, adding more ambulances. These are the types of decisions that they're making. These are not easy decisions. These are not something that they take lightly by any stretch of the imagination. So.
But I think your point is also valid that all of us could have done a better job closing the loop with the board. So the board recommended this, that didn't happen, and you weren't notified that that didn't happen. You shouldn't have heard that from a community partner. You should have heard that from me. So that is something that we will improve.
When you said there are 4 FQHCs in the county, who are you including in that list?
Oh, gosh, I don't know. Alice told me there were 4.
Yeah.
There's a lot.
So it's
Well,
Winches,
let me-
Blue Ridge, Mayheck, and
So-
Appalachian Mountain.
So that's my question. Blue Ridge Health is included in
Yeah.
that because I'm on the board of Blue Ridge Health.
Yeah.
And so this kind of decision is going to probably impact Blue Ridge Health too. And so, okay.
Yeah, because they have an office in Arden, so they're in
Yes.
Buncombe County as well. So
Yes.
they're the 4th
Okay.
entities.
Well, that's a fairly recent, so I didn't know if they were included in that. Yeah, okay. Well, there may come a time when I may need to recuse, but this was just a question.
I mean, Blue Ridge is also in the school system.
Yes,
And also in
yes,
the Bay. I mean,
yes.
they're doing a lot of stuff in
Yes,
Buncombe.
yes.
So.
All right, so the plan is that I will check with Alice when she gets back from vacation. See if she thinks she can pull together the information for the next board meeting. And it will be a report to the full board. If she says no, I will send you an email and let you know that it will be the meeting after that, in order to give her enough time to feel comfortable presenting that information. Is that acceptable?
Wish there was a way to capture some tourism development authority money for so much of this. I mean, this is just insane.
Well, what about opioid, from the opioid money,
I mean, they're
the
throwing-
cigarette money? I mean, this is health related. I mean, tourism sounds good, but the other stuff's health related.
I mean,
money.
If we were the
crazy thing, Steve,
Yeah.
is that the state is sitting on $1 billion that they haven't allocated yet. Of an over, they have $1 billion extra. We were supposed to, in this county, get all this money from HCA's taxes and all
Right.
that stuff.
Right,
What happened to that?
yeah. I
You
mean,
know,
that's like 3 huge
There was all
revenue
this money that was
sources
supposed to be
There's the
coming
Medicaid
in
extension.
Yeah.
to help, and it's like, it just like,
There's
I don't know.
there's many health pots of money that are.
I'd love to throw Stony a $20,000 retirement party like for their head. You deserve it.
I'll donate that back to.
Okay, so I'm gonna now pivot to the foster care memo that you all received. Rebecca has rejoined us. And Rebecca, what I told them was that you were here for questions. So what questions are there? And you do have a hard copy of the memo if you. She worked very, very hard to get it to be 1 page, even though it's 1 page front and back.
So my first question is, who's this memo intended for?
You.
Us.
Yes, because
The
this
board.
came up at the last meeting.
Okay.
And so this is a follow-up,
Okay.
closing the loop with you on some of the issues that were left open at the
Okay.
last board meeting.
This is informational for us to then take and do something with.
If you so choose.
Thank you.
Rebecca, in terms of hosting events, can you talk to us about models that have been used in the county previously and what our board could do specifically?
So for those of you who don't know, we have a licensing team internal to Buncombe County Health and Human Services. We have 4 licensing social workers, and a portion of their job is to do recruitment for foster parents. So think about all the people in Buncombe County and think about how much 4 people can do as part of their job, right? They're going, and most recruitment happens during non-business hours. So they're going at nights and weekends to different events. They're tabling, they're going out to churches, they're doing this work. But imagine what it could look like if that was multiplied by all of you and maybe other people outside of this room. Not so much you have to go to these events, but just when you're at events, talking about this crisis and about the need for foster parents. And so I wanted to try to use this as a way to give you information about what the crisis looks like, what the numbers are, and why the need is so great. And then just ask that you go out in the community, and if you have those opportunities where you, like, maybe there's a supper club that you're a part of, and you would be willing to allow one of our recruiters to come out and meet with your supper club, or you have a church group that you're a part of. Maybe they could come out and meet with your church group if you believe that they might be interested. So we want to partner. We're not asking you to do our jobs for us, obviously, but we could potentially make our resources go farther than they currently go, outreaching to more people to say this is the need. I think that the one pager also tries to provide information that this is not about all the children in foster care. This is about children with complex behavioral health and mental health needs, sibling groups of 3 or more, and teenagers. That's really where our needs are. And that's when we say we need foster parents, that's the type of foster parent we need, is people that are willing to work with us to provide care to those specific children. So that is, that's kind of what we've been doing. The idea is to try to get with some of the recommendations on the back of what you can do, is to try to get a more targeted audience to say, these are people that might be interested, that have expressed interest, and let's get them together. And then if you have not watched The Sound of Hope, Story of Possum Trot, it is an exceptional movie. It does have a religious undertone, just FYI. But it does a really good job of kind of showing the children that have those special behavioral and mental health needs, and how the community can come together to take care of them. That they're not, throwaway children, because that's sometimes how it feels. Did I answer your question?
Are there other questions for Rebecca?
This is really great, Rebecca. This gives us a lot of good information to take back to our networks,
Well, it was your idea to frame, so.
I forgot. You're just amazing because you take these ideas and you run with them, It's really, really great.
I assume we can make copies of this.
Yes, and I have more, and I have them with the foster parent recruitment pamphlet attached. So like if you wanted to give it to people out in the community, you're welcome to take those as well. It has the numbers.
Just to kind of comment a little bit about the power of this kind of work in our community is that I've been learning a lot about social capital. And social capital is that each one of us around the room has a lot of social capital. Every person pretty much knows about 20 people. Each one of those 20 people knows 20 people. And so in 3 iterations, you reach about 2,000 people. And with our social capital, because we know professional folks and we know folks that have resources in different, in different areas, and the ability to get information out like this and to find the right people quickly, you can do this really fast if we just talk to our networks, our social networks, our professional networks, and let it just do the work. It just does the work for us in getting people engaged. So.
Thank you. We move now to our 6th agenda item, which is new business. And on that, it is August, and this is when we elect officers for the coming year. And we need to elect a board chair and a board vice chair. I would like to open the floor for nominations for the chair position. Linda.
I would like to nominate Lucy for another term as board chair. And in that vein, let me say a few words if you don't mind. We have a lot of changes coming. We don't know exactly when that's going to happen. We'll talk about the new director position shortly. But the executive committee had a discussion about this, and we think it would be helpful if we had some continuity for the next few months through this change. Meanwhile, there's several long-term members of this board who will be rotating off probably sometime in the spring. I'm not sure exactly when. So at that point, Lucy's one of those folks that we'll be losing in March, is it?
Mm-hmm.
March, April. So that position the vice chair most likely will move up anyway. But that's my rationale for nominating Lucy for a 3rd term. Is that correct? A third?
Is it a 3rd? I'm looking at Greg because I
Yeah,
succeeded him.
And so I'm sure that she will open the floor for other nominations, but that's the reason that I nominated her for an additional term for board chair.
But to be clear, in March, you will rotate off.
Yes.
Right, according to our procedures or the rules is that we have annual elections after the new fiscal year. So the first meeting after the new fiscal year, which would be the July meeting. That whoever's elected would serve that full year. If, let's say, the chairman, resigns or somehow leaves or is off, then the vice chair would take that position. Then you would have the open vice chair that you could either elect somebody at that time to serve the remainder of the term, and then come July 2025, you would hold new elections to elect a new chair and a new vice chair for that term until 2026, if that makes sense.
The terms are 1-year terms?
Yes.
1-year terms.
So I nominate Lucy.
Are there other nominations?
Do you accept?
Oh, I'll accept. For the reasons of continuity, and because there is going to be a lot of change coming on, and it would be helpful to have institutional history. Other nominations? Okay, I always feel weird doing this, so.
So I think then the next thing would be is that somebody make a motion to close nominations.
I second.
All those in,
Do I have to do that?
you could do all those in favor.
All
of
those in
closing.
favor? Any opposed? Okay,
All right,
so,
now,
no.
since you only have one person that is nominated for president, then you move to vote.
okay, let's vote. All those in favor? Any opposed? All right, thank you.
Thank
just
Thank you,
till
Lucy.
March. And so now we move to the election of vice chair. And as you explained, this person would most likely move into,
Yes, so the vice chair would fill in for Lucy during her term when she can't make a meeting or something like that. The vice chair would also, when Lucy rotates off in March, become the chair they can either be the interim chair until the next election or be the chair until the next election, if that makes.
okay. I open the floor for nominations.
I think I'm the designated guinea pig today. I nominate Dan Frame. And I understand that that you're willing to do that, is that correct? Vice Chair?
I've said no before, but yes.
The time is
But yeah,
right.
the time is right, yeah,
Right,
so
so-
I'd be willing to step up into that position. And be the vice chair and whatever happens in March.
So I nominate Dr. Frame.
Other nominations? And we need a motion to close.
If there are no more
If there are no more nominations,
yes, a motion to close nomination.
thank you, Greg.
Yeah, again.
Leanne, thank you. Okay, good.
Leanne's like the designated second. She's like always making the second.
All right, all those in favor of closing nominations? Great. And now,
All those in favor?
all those in favor of Dan as vice chair? Wonderful. Any opposed? Thank you. And Dan, welcome to exec committee.
Tony, that's your parting gift.
All right, so item number 7, Colleen's director's report.
Okay, so it's been 4 weeks. I now know everything there is to know. No, it's been a lot like kind of drinking from a fire hose, but it's been a lot of fun. The staff are, of course, amazing. I'm enjoying learning from them. There are a couple of major projects underway right now, and they all kind of cascade into each other. So at the top is the countywide strategic plan. And the department, of course, figures prominently in some of those priorities and goals. Part of that also involves the department creating a business plan. And so we are working on a 4-chapter business plan for our department, one for each of our divisions of public health, social work, and economic or community resources, depending on who you ask. And then the 4th one is just general administration. So and all of this is due before my time is up. So we will have this all done. One of the components of the business plan is addressing the employee engagement survey results. So I'm assuming y'all are in the loop. There was an employee engagement survey done by Qualtrics. The county has gone through a prioritization process. The department has gone through a prioritization process of those results. Our focus areas, if I can do this off the top of my head, are essentially communication, trust, and collaboration. And so we are working with the staff. We had 2 all-staff meetings, they were both virtual, where we did live polling to get the staff's input into potential ways to improve communication, trust, and collaboration. And we had over 500 people participate in those meetings. There were options there were questions with multiple choice options that they ranked. And then there were open-ended questions where they could type in additional information or nuance into some of their responses. We had the last meeting yesterday. These weeks just kind of all blur. Last meeting was yesterday, and I just, while we were in here, got the final spreadsheet with all of the results from that. We will take that information at our next senior leadership team meeting and come up with what we're going to focus on for the next year within the business plan. So the business plan has to have at least one goal that addresses employee engagement. It will also have multiple initiatives. That's where we get away with doing all the stuff. We may have a pretty broad goal, and then we may have 4 or 5 initiatives that we look at specific to this employee engagement work. So that's been a lot of fun. It's been a great way for me to interact with the staff. And it's been a great way to improve trust and communication because it's very open, very transparent, and very inclusive in getting staff's input on the best way to move forward. So that's been one of the major initiatives that we've been working on. The other thing that we're working on is figuring out how to seamlessly integrate behavioral health into the public health area. And there are a lot of moving parts with, as you mentioned, the opioid settlement funds, the opioid fatality task force, review teams, substance abuse task force. There's just lots of moving parts. So had a really great meeting across the county to try to figure out how to put all of this together. And Ellis is doing a good job of trying to understand the details of what's going on. So I imagine in the next couple of months, both you and the Board of Commissioners will get a presentation to kind of synthesize what all of these moving parts now look like together under public health. So those are the big items at this point. Questions?
So is the mental health, substance abuse, is that going to be a task force, or is that going to be like more of a permanency to this restructuring?
I guess the answer is both. So there is a task force that is focusing on opioid overdose and death. And there are programs across the county that are not just focusing on opioids, they're focusing on all substances to which you can become addicted, and focusing on what are some of the upstream factors that we should be focusing on in order to stop just reacting to the problem of addiction. And so it's both. There's a concerted focus on the opioid overdose and death, and there is the systems level work now falling under public health to figure out what our entire behavioral health landscape looks like.
So public health is going to be growing quite a bit.
Well, it's funny, it's a staff of 1 right now.
It just sounds, like it's a
But
lot
the
of
thing
growth.
that public health's really good at is it's a staff of 1, but if you took all of the people across the county, even just the county entity, you're talking hundreds of people who are working either directly or peripherally in the world of behavioral health. And behavioral health is kind of an umbrella term that includes mental health, substance abuse, et cetera. And so yesterday we talked about the fact that we need to have like a Venn diagram that shows where these worlds are overlapping. So clearly there's overlap between substance use and mental health. There's overlap between those 2 things and homelessness, which is another major priority for the county as well. So all of those conversations are happening. And right now we're just kind of helping people understand what that system looks like, identifying where we need to tighten up our connections, and helping to facilitate that process. So I don't expect to see staffing explode in public health, but there may be some grant opportunities to expand a little bit.
Sounds like there's a big growing need. Because if you ever pick up a newspaper, that's what you see on a daily basis. I just didn't know if planning for growth is in the future.
there are a number of grants that have either been submitted or are pending. And of course, you know, there's the opioid overdose or the opioid settlement dollars, but it's never enough. And then there's our local mental health entity, VIA, who is the ultimate point on all things mental health and behavioral health. And so we're working very closely with them as well.
Sounds exciting.
Yeah.
Are those opioid funds, are they a sure thing? I don't know, there's something that's been in the news that's made me wonder, is that really gonna happen? Is that money already here?
Yes.
Okay.
Yes. Now, the thing that's unsure is how long it will last. But if you think back 15 years to the tobacco settlement dollars, it's a little bit like that. So the state's going to take their cut, but definitely there is money coming to the local counties.
I don't remember what it was that I saw that made me wonder.
There was something about some settlement being rejected.
Yeah,
I don't know what, I think it was the Supreme Court, to be perfectly honest.
yeah, that's what I was
But I'm
thinking.
not
but
sure
I-
if that's applicable because there are a
Multiple,
multitude
Yeah.
of lawsuits. And I
Yeah.
think the one that we are operating is under the one that the North Carolina Attorney General has filed.
Well, there's something about that family.
It's the
That was the
Sacco-
Supreme Court too.
Yeah.
They
That's the
rejected
Sacco
the
family.
plea
Yeah.
deal or something.
They don't want
But
to bleed them for the next 5 lifetimes.
But the money's there. Okay, all right. Thank you. I didn't dream that.
No, you're
Where did I
not.
hear that?
Question for Rebecca. You mentioned some time ago that VIA might be collaborating to develop a residential treatment center for adolescents. Is that still in the works or conversations still going, or is that?
Yes, you've hit on a pain point for me. So yes, we've been working in partnership with VIA, with what's now called Blue Mountain Behavioral Health, out of Henderson County. They were going by the name of Bear Wallow, but they just changed their name. Their license has been held up. I just spoke with DHS, Division of Health Regulation Services, around their license to try to get an understanding, but right now it's being held up. I won't go into the details. And they're also currently not in NC Tracks, which is how they get paid through Medicaid. And so both of those things are preventing us from contracting with them, with our emergency placement dollars. But as soon as those get cleared up, we're ready to go with a contract to be able to spend the state emergency placement dollars to have children who meet the criteria enter their facility. It's a 4-bed emergency placement. 4 beds for emergency placement is what we're contracting for. They also have a 20-bed facility for level 2 as a level 2 group home. So they're trying to get the entire thing licensed and up and running.
How many of the foster kids with behavioral and mental health issues could be benefited or impacted by the program? Percentage-wise, would you guess?
I do think that if you look at the numbers that are on the page, where we're talking about 77 nights we had children in our care, I do think at least a third, maybe even a half of those kids could have been at this facility. If we can get it up and running and, yes, I do think that it's part of the solution. They only take children 12 to 17. So if there's larger sibling groups that are younger, or there's children, like more recently, we had for 3 weeks, we had a sibling set of 3 that were all under the age of 10, that all were on the autism spectrum. And so it won't solve the entire problem, but it will contribute to the solution, yes.
All right, that's my report.
I feel like
Thank you, Colleen. We now move to Chairperson's report, and I want to begin by calling your attention to the sheet that is in your packet. And it is July, and again, it is time for us to make our preferences for committee designations. So if you will please make sure that your name is on this sheet, and if you will rank the committees that you would like to be part of, first, second, and third choice. And then in exec committee, we work some musical chairs magic and get everyone placed into committees for the next year. It is very helpful to have your input, because we want to make sure that your preferences are honored as much as possible. Yes, great.
And while it's the ultimate goal that during your tenure, you have exposure to all three different areas, you don't have to necessarily rotate every year. If you want to increase your knowledge or experience in a particular area, you can sign up for your same committee again if you want to, right?
Absolutely. And if you can just make sure that these sheets go to Krista or to me before you leave this afternoon. All right. And so our next item is an update on the director recruitment process. And Linda, who is a member of that interview panel, along with Elizabeth, Lima, and myself, is going to provide an update.
Things are on hold right now. We started out with 6 applicants. Before we even started interviews, one had withdrawn his or her, I'm not sure which, her application. So we interviewed 5. From those 5, we projected or requested second interviews with 3. Before we had those accomplished, one of those withdrew, which left 2 active applicants. All 3 of those were scheduled for early August. And so the second interviews were not done yet. We got an email earlier this week from Sybil that the county would like a larger pool. So the interviews are on hold for now, and they're going to repost the position. And so the 2, from my understanding from your email, the 2 that were in our second interview line will stay in that position, and then we'll go from there. And so that's where we are. All 6 of the applicants originally are North Carolina residents, so we didn't have to contend with that kind of an issue, but that's where we are. And so Elizabeth and Lucy and I have been a part of that, and it's been really fascinating to be a part of that county activity. We asked them all the same questions. I had a list of questions. We shared the questions, and so we'll see where we go from there.
And
The 19th is when we'll do first review, August 19th, so of this next round. So if you all can spread the word, I can send a link to y'all and send it out to as many people as you know. We'd love any help you might be able to share for recruitment.
And it was reposted again on Tuesday.
Yes, it was, reposted immediately.
I had looked online at the job description. Had y'all changed it any, or is it the same that was? Okay.
Can we answer any questions about the process thus far? And Sybil, you said there were 30-ish original applicants that were then narrowed to the 6 that we invited for the virtual interviews.
Maybe Colleen and Stoney are friends. They should,
I've been doing some
they
recruiting.
should call up and just.
Yes.
Yes. One of the questions I have that's not been a part of the interview process at all is, I'm wondering, because we're such a high cost of living area, has that influenced applicants in any way? Do you have any sense of that?
I can't speak for this pool, but I can say generally we do get that feedback from applicants. We will often go through the process and then they realize, oh my gosh, it's going to be really expensive to move here. And so they will withdraw towards the end of the process. So that does happen.
All right.
With the winnowing of like 30 to 6, what funnels them out? Is it like,
It's minimum qualifications and HR will do that for us and say, these are the 6 people who meet those criteria.
when those are like degree requirements or?
Yes.
With Workday, we post on, our job ads get posted on Indeed. And so I don't know if any of you all have had any experience with Indeed, but you tend to get a lot of people who really shouldn't be applying for your position, applying for your position. So there's a lot of that when you're weeding that out, you know, kind of like.
But you're absolutely right. It's
Whether you're applying.
education, years, all those things, yeah.
Do you only use that one job search site? I mean.
No, but so like we post through Workday, through our with whatever our system is, they have links that they go out to. We also probably, there's a job network with the North Carolina Association of County Commissioners. There's the North Carolina League of Municipalities. Those are probably the 2 main government job things for North Carolina. There's also governmentjobs.com. Those are the 3, I think, that like specifically target government. And then, I know HR will look at other specialty organizations that you may get out, like listservs. I'm sure that we'd send that out to the Health and Human Services listserv and that kind of stuff. So correct me if I'm wrong, but.
No, that's correct.
So hopefully we will have more robust news to share at our August meeting. If you still have August 2nd as a called board meeting on your calendars, you can cancel that because we don't have any finalists to present at that point. So we're looking at most likely sometime in September, probably.
So we went from the first interview to the second interview. After the second interview, what? I mean, if we interview 3 people a second time, then what happens?
Then we would make a final decision on the person we want to make an offer to.
Do you want a recommendation from us and a
Yes.
ranking? Okay.
Yeah.
Okay.
That'll be a discussion we'll have with the whole interview panel.
Okay. Thank you.
All right, so the last piece of business, Stoney, thank you for hanging around for so long. Hey, I need to put things together real fast. We do want to appreciate you for all of your work as director. And for many of us, you have been the only director until Colleen that we have known. So do you want to stand up for a second? All right. We have a card from the board. We also have, and I don't know if I'm going to open this because I don't want to get my fingerprints all over it. Okay. So we have a plaque that, I don't know what side it reads on. Okay. The Buncombe County HHS Board gratefully honors Stoney for your steadfast advocacy, wisdom, and care. Live well, laugh often, love retirement.
You guys up against the wall, the petition there, that'd be a good picture.
And, well, we can do that in just a minute. And then a little bird told us also that you were planning on doing a lot of camping in your retirement. So we have a gift card to REI.
This is nice. I'm just set up my home office last week, so I'll proudly display this on my bookshelf. If you ever do Zoom meeting with me, you can see it. Well, thank you. I should save it for you back.
Sure, sure.
I'll hold it.
Yeah, your thing.
Simple Zoom.
That's my bad.
Thank you. Okay.
Everybody should be in the picture, actually. All right, and so finally, we are at adjournment. Our next meeting is going to be September.
August.
Oh, why am I thinking it's already August? Sorry, I don't mean to start school earlier.
That's right.
So August, 23rd. All right, and, would anyone like to entertain a motion and a second to adjourn?
I so move that we adjourn.
Thank you, Linda. Any seconds? Thank you, Leanne. All those in favor, see you next month.